Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. What are some exercises we can do to help our ties if we can't immediately do a revision? So, first, we want to know those ages. Are they babies? Are they toddlers? Are they school-aged? Like that? Are they adults? Like that's going to matter for sure. Always want to get big full body movement, crawling as much as possible for adults too, okay? It's important that we are moving both hemispheres or both sides of the body to engage both hemispheres of the brain. We want to be doing this to get this full body input. We want to be chewing real foods. If we're not at that place, chewing chewy tubes, myomunchie, a vibration toothbrush, things like this, just desensitizing the oral cavity, especially if we have like highly sensitive gag reflex. We're not ready for a revision, even if we had all the money and the time and everything. We need to start desensitizing. So let's prioritize real food. If that's not something that we can do yet, working with a feeding therapist, absolutely love that. If we are an adult, I would say let's incorporate rolling. Let's warm up the fascia of the body because it's a whole body experience. Let's start the big thing I really want you to work on, dissociation, or what that means is being able to move the tongue without moving the jaw. That's a huge one. So we really want to be able to stabilize the jaw. It's just that floor, that foundation, so the tongue can then do all these crazy movements. That's what we want. So really being intentional about moving the tongue without moving the jaw. This is trickier when they're little guys, okay? So that is really beneficial to work with a provider. Right now I have my course that can be helpful for that, as well as my toddler workshop. Both of those are up if you follow me on Instagram, or you can get to them on my website. So those are great tools that we want out there because so many people reach out every day that they can't take those next steps, but they want to do something at home. These are great things to do right away, right now. So I want to talk about stabilizing the jaw. And then where's your tongue tip? So there's so much more to myo than tongue tip to spot, which just means your tongue tip is resting behind your 2 front teeth on your palate. However, it is such a foundational concept and such a tricky one to teach if you haven't worked with a myofunctional therapist. Like if you're just trying to figure this out at home, sometimes that can be hard. So focus on that. It's going to be a great starting point for whatever age. Next, we are going to answer this question that was submitted on Instagram. You can follow me there at myohackerslp and send me a DM with the question that you would like to be featured on the podcast. The question is, I'm working my way through your course and it's so good. I have 2 girls, both with ties. I released my eldest tie at 3 months, but we still struggled afterwards with crowding, narrow palate, cavities, and mouth breathing. We are doing myofunctional therapy now and have done bodywork, chiropractic, and CFT, which stands for craniosacral fascia therapy, since she was born. She's 5 now. My youngest, who is 17 months old, has a tie as well, but we decided not to do a release. Her function is so much better than my first. So her function at 17 months old is better than the oldest child's was. We are doing chiropractic, but notice her teeth are close together. She has not used a pacifier and is breastfed. What should my next step be? She's too young for myo, but I want to be productive in this waiting phase. So her question specifically is about the 17-month-old, so I'm going to address that. What you can do really is we want to see what is her body function like. If her teeth are really tight together, then of course I'm going to want to promote chewing. I'm going to want to really build that space through we can use chewy tubes and chewing foods. But if she is tight throughout her body, then you're going to see that she's going to clench down and things are going to get tight at midline. So I would love to know what the chiropractor and CFT provider are finding. Like, what are they feeling? Do they feel that there are fascial tension restriction patterns that keep occurring and that is limiting growth that we would love to see in the mouth? Is that why her bite and her teeth are coming in close together? Which, for your reference, you should be able to slip a coin between each baby tooth. Like, it should have enough space that when those adult teeth finally erupt, they've got plenty of room to grow in. And if things are crowded at 17 months of age, we know they're going to be crowded as she gets older. So that is where I would say, tune in, find out what have the chiropractor and CFT provider found. Since they've been working on her for such a long time, they should see that there are some patterns. It might be that she's got some primitive reflexes that are getting in the way of movement, or it could just be that she hasn't really worked in that chewing in the back, on the back or sides of the mouth, and that instead she's got a munch chew pattern. And if that's the case, then I would love to see, like, what is a feeding therapist, or what are they doing? So it looks like the older sister is seeing a myofunctional therapist right now, which is great. I would talk to that provider and say, hey, I am seeing some of these patterns that we see in our older daughter. They're showing up in my 17-month-old. Who can we work with here? If this myofunctional therapist doesn't work with feeding and younger children, then who do they recommend? Like, really lean into your local providers. Same with the chiropractor and CFT. I'm also curious, have they already recommended that? Like, is there some disconnect right now between the communication of the team, between what they are recommending and what is just feasible and possible as a family? It might be that you have to toggle some and you go, okay, right now, because we see that the mouth is so tight, we need to spend a little bit more money on things like the myomunchie, on working with a feeding therapist. We need to get some of that and see if you can shift things a little bit with either feeding therapy, some different tools, or getting an airway evaluation, with a dentist in the area and get their perspective on what's going on. So I always encourage, it's wonderful that you already have a team. So let me know, what have they said? Like, what advice have they given you? What are they sharing on the topic? And it might be, it's hard. If you've been seeing someone for a long time, it can get a little awkward where it's like, well, we're kind of stuck in this pattern, but they're doing what they do. Try to be open and have a conversation that's not, you're not challenging. You just want to know, like, hey, are we making progress here? Because I'm seeing some of these things and maybe we want to shift. Maybe we want to actually try a different technique or intervention and see if that can move the needle. So thank you so much for your question. Again, guys, you can submit those on Instagram and I love to address them when we can. Let's take a moment to talk about one of my absolute favorite tools for supporting health and wellness at home, ozone therapy. I'm a huge fan of finding effective, science-backed ways to support our body's natural immune defense system. That's why I've been using the Stratus 3.0 ozone generator from Simply O3 for years. Whether it's tackling ear and sinus issues or boosting overall health, incorporating ozone therapy at home has made it so much easier for my family to overcome illnesses and proactively defend against sickness at school. As a busy mom and business owner, I love that I can support my immune health without needing to run to a clinic. And let's be honest, Most of the time, when my kids get sick, it tends to be at night when clinics are closed anyways. Simply O3 makes it incredibly accessible to bring the power of ozone therapy into your home. Their equipment is easy to use and designed with safety in mind. And because you're part of the Myohacker community, Simply O3 is offering 10% off your purchase when you use the code Myohacker. Just head on over to simplyo3.com to check out their ozone generators and supplies and use the code Myohacker at checkout. I would love to dive into a quick discussion about dysautonomia. So, a lot of adults who come in have symptoms of dysautonomia, which that can be where your nervous system isn't regulating, blood pressure can go through the roof or it can totally drop. You can have symptoms of, you can be sweating, you can get cold. There are a lot of different symptoms that can come along with dysautonomia. We should probably have a podcast strictly on it. But what we can talk about from a myofunctional airway perspective is that so often those patients need cervical stability. And when they come and find me, they're usually trying to ground their cervical or the vertebrae in their neck through clenching, through biting. So think of the back of your teeth. They are the top of your spine. So if somebody has cervical instability, and that can be for a number of reasons. It could be from injury. It can be EDS, Ehlers down low. And anytime we have loose connective tissue that isn't really keeping the cervical vertebrae nice and tight where they should be, or let's say we, for whatever reason, have strength on one side, more weakness on the other, you can have some of that. And I'll let a chiropractor speak to all the reasons why that can happen. But one compensation that we can see is clenching through the teeth. This does give a lot of feedback to the brain. It does send a signal that's very strong about where we are in space, but over time, we can see these increases in anxiety. And this can lead to panic attacks, maybe not even that acute. Panic attacks, I feel like, are, in a way, they're good. Like, you come in if you're getting panic attacks. People seek out help. What's tricky is if you're not having quite a panic attack, but you just feel terrible. You just feel really anxious. So notice if you're starting to feel a little dizzy, a little nauseous, you're sweating or your feet suddenly get cold. Clenching is where you lean, is where you go to try and get over that wave of feeling that can come over you. I highly recommend that you get in with a provider to first. I love it if you can see a chiropractor who is gentle. You do not need someone cranking on anything right now. This is a very gentle approach to help your nervous system get to homeostasis and a balance. That is going to be beneficial. Specific PTs can really help with this as well. Of course, myofunctional therapists, that the thing is, as a myofunctional therapist, I want to go in and treat that jaw. I want to go in and treat that compensation pattern. And I have to step back for a second and see, I need to regulate my nervous system, because it's very easy in a case like that for me to kind of reflect what I'm feeling. So I need to make sure I am centered when I'm addressing concerns this patient has, and that really can't go in there and shift that jaw yet. Usually there's one side that's moving more than the other. So you might have one side that's kind of wide open, and they have a lot more opening on that side as they open and talk, and you'll see a lot of jaw grating and gliding as they're speaking. And one side's pretty tight. And the cranium, it's going to try and solve this problem by tightening down around the occiput and in the back. And so you'll feel the fascia of the cranium can be really tight. So as a CFT provider, I have to be very, very careful on the input I'm giving. If I am doing just a little bit of an occiput hold and the fascia starts to unwind, they can get dizzy. Okay, so I'm not saying we don't treat this, but I want it to be treated very slowly. So if you have TMJ issues, if you have migraines, let's say you've been exposed to mold, Lyme's disease history, all of those things are going to make you a little bit more prone to a dysautonomia diagnosis. You don't even have to have the diagnosis, okay? The diagnosis just helps in some cases. Some cases it doesn't even help, but it can provide some clarity and just help you to not feel crazy, okay? That can be beneficial, but there are lots of things we can do to support the nervous system, to support how the heart rate is shifting and changing, how we are sweating or not sweating or feeling gravitational pull more strongly and just really being affected by movement or our eyes shifting more than we would like to be. Okay. So in many of these cases, we do need to stabilize the bite, but that doesn't necessarily mean with an orthotic or an appliance of any kind. Sometimes that's the tool that we use, but sometimes it can be that we need to practice things like using biofeedback techniques. We might use some kinesio tape on that side that has that exaggerated, bigger movement than the other side. We might go in and use and strengthen. If it's because there's weakness on one side, that's when it's a great moment to practice using a chewy tube slowly, okay? I'm going to emphasize that again and again. With this context, we want to be slow in treatment approaches, okay? But chewing on that side of weakness, that can help to bring things in so they're moving in coordinated movements. Being mindful of what you're chewing. I'm not saying not to eat a bunch of things or to be restrictive of your diet, but just be careful and mindful of that, because especially if people have issues where, it's slipping so much that they're hearing that clicking and popping, we want to be very careful of moving to having the mouth open too wide and these really large movements until we can support through muscle engagement and truly like bulking up the tissue density so that there's more support. And it's not just like ligaments and muscles pulling on the TMJ, but that it's actually more of this foundation of strength through the jaw muscles. And we do want to have that support. Okay. So again, if your neck is really unstable, if you've got this cervical instability, then even if you stabilize and have things working better in the mouth, you might find that you're getting significant neck pain. So this is where it's so wonderful to have a great chiropractor, or like I said, some PTs who specialize in these things to support with strengthening of the cervical spine, of just the muscles that gird the spine. We want to have that strength. We want to have really good core strength. That, if you're unstable on your feet and through your pelvis, you're going to be unstable in your neck as well. Or you're going to try and stabilize through different ways that can be maladaptive. I also just want to say, I'm so sorry. This is such a hard diagnosis. It can be very isolating. And I see a lot of people that it like freezes time. Okay. So if you feel misunderstood, if you feel scared, it's very normal. Okay. Because this is a difficult diagnosis. So I want you to take a breath. I want you to really lean into hydration and self-care, taking a beat off of getting all the to-dos done and tuning into your body. That is going to help you with these moments of hypermobility in certain places, which if you're having that in the jaw, you're going to be having it very likely elsewhere. So it helps you to tune into where that is. And sometimes our bodies, we haven't noticed that there have been pain signals that have been growing and growing, but we've just had to push through for different reasons. And then suddenly we get to a point where we can't push through anymore and it stops us. This might be a moment like that for you. So please find community if you don't have it. It's so important for the healing process to have that support. Okay. And it's a hard journey to make by yourself. So I want you to have people that you can connect with. You can reach out on Instagram and just let me know a little bit about what's going on. And I just don't want you to do this alone. Okay. So get connected to your community, to your body, and then to a provider who is local. You're going to need this one. Yes, you can do teletherapy and different things, but you're also going to want someone to lay hands on you and feel what is going on. And you're going to want some inflammation support. There are also often hormonal factors at play here, and they can be that they were triggered by some inflammatory instigators that came into the body and shifted some of that. Your adrenals may have gone off and your cortisol was so high and that it's tanked. We won't go there. I'll just say that there are a lot of factors at play, and it can really help to reduce some of the inflammatory agents in your environment that you're breathing in, that you're ingesting, even just that you're watching and taking in from an entertainment, TV, whatever standpoint. Okay. Thank you so much for this question, and let me know how it goes. I hope you have enjoyed this episode of the Myohacker podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.